Hey, Dave with Align Therapy here. It's time for another scoliosis research article review, and I have a really interesting one for you today. This is in Spine Journal, and it's called Associations Between Paraspinal Muscle Characteristics and Spinal Curvature in Conservatively Treated Adolescent Idiopathic Scoliosis, a Systematic Review. So in this research article, they did a systematic review where they go through and they pull different studies and they compare and contrast those studies and see which ones will be included in the study. So this isn't a study where they designed it. This is a study where they're looking at studies, and they were looking at paraspinal muscle characteristics. So the paraspinal muscles are the muscles right along the spine that go the whole length of the spine. And there are a bunch of different muscles. We're not going to get into anatomy for this, but it's interesting because in a normal spine where the spine is straight, the paraspinal muscles are pretty symmetrical, should be symmetrical. When we have a scoliosis curve, we have a convex side of the curve and a concave side of the curve. And because of that difference in orientation, the muscles are different on that. So it's interesting in this study that they actually mention in their conclusion that they don't know if this is a cause or a consequence. And I think that's important to understand that in scoliosis patients, we see a difference between the convex and the concave side of the curve. Is that difference what created or made the scoliosis progress? Or is that there because of the scoliosis and that? In my opinion, I think it's more that's the result. That's a consequence of having scoliosis, is you have an imbalance between the two sides, the convex and the concave side. I have no research to back that, but that's my opinion. I think the muscle changes happen because of the scoliosis curve, and the scoliosis curve seems to happen because of the bony changes. But we can get into that in a future research article review. So in this research article, they looked at there were multiple findings that they found to be consistent. So they looked at the convex side. So just a little review on concave and convex. So if we have a curve like this, the convex side is this side. So it's the curve the side that the curve is going towards. The concave side is this side. So the concavity or the cave, I talk to my patients about that being the cave, and that's where gravity is kind of collapsing the curve into. So we have the concave side, we have the convex side. Usually in general physical therapy, when I was in school, we talked about the convex and concave side is how we would treat it. So the concave side we would stretch and open up, and the convex side we would strengthen to pull the curve open and to straighten it out. The problem is, as we get into this study, that the differences in the muscles don't really play to that. If you do that, you're actually increasing the muscle imbalance even more. So let's get into what it talks about. It talks about there's lower evidence to support that the convex side, so the side that the curve is going towards, this side, had more type 1 muscle fibers and a higher muscle volume and paraspinal muscle activity. So on that convex side, we have more muscle mass. We have more type 1 fibers. We're not going to really go into that, but that's the endurance fibers, the ones that use more oxygen, and that there's more activity in those muscles, and so they're more active because the curve is trying to push into that convex side, the convex side, and those muscles are trying to stop that progression into that side, and so there's more activity. So that begs the question, if we are trying to strengthen that side, it's already imbalanced where that side is larger than the other side. So we're just playing into that imbalance more, and it's already more active. So we're taking a muscle that is already more active and doesn't seem to be turned off much, and we're asking more out of it. And that's when we usually see more pain. Most of my scoliosis patients who have pain, it's on the convex side of the curve. Not always, but most of the time. So on that convex side of the curve, we have more activity out of those muscles, and that's why they're sore, because constantly all through the day, especially standing, even sitting and doing other things like that, we have more activity out of the muscle. And when you have more activity out of the muscle and it's not turning off, then you get spasming and tightening down. So the traditional way of strengthening the convexity, it just doesn't make sense to me at this point. If we look at the concavity, so this study is showing the concavity had more intramuscular fatty infiltration. So it was smaller in size compared to the convex side, and it had more fatty infiltration. Fatty infiltration is where fat gets deposited in the muscle, usually because of atrophy and because of weakness and disuse. So it's not being used as much, so the body starts to store fat in that muscle tissue. And it's not great because that creates weakness because fat doesn't contract. Fat is not a contractile tissue. And so we get weakness because that fat is being laid down in the concavity in those muscles. And so the idea of just stretching out the concavity and opening that up to fix the scoliosis or to treat it really doesn't make a whole lot of sense. We do need to open that side up, but those muscles are very weak, very weak. The problem is if we try and strengthen those with them being tightened down in the concavity, we're just asking for more of a concavity. So we have to open that up. We have to expand that concavity, and then we need to strengthen up those muscles so that we can get more support out of those muscles, so there's not the imbalance between the two sides. I think it's really interesting in the conclusion of this. They say our review highlights that paraspinal muscles on the concavity of the curve demonstrate consistent changes, altered muscle-related gene expression. That's interesting. We're not going to really go into that as much. Muscle atrophy, so we have that atrophy, the fatty infiltration, and reduced type 1 muscle fibers, and reduced muscle activity. So we have this imbalance that's happening between the convex side, where the convex side is more active, has more muscle mass, has more type 1 fibers, which are the postural muscle fibers that help to keep us upright for a long period of time. And then the altered muscle-related gene expression, we won't go into that. So we have that happening, and we have this imbalance that needs to be addressed. I don't know of any better way to address imbalance of the paraspinal musculature than doing the Schroth method or doing the C's approach. Really, it's based on teaching the body how to pull out of that concavity, how to open that up, and how to activate the muscles. I would say between the two, the Schroth method has more techniques to really open up that concavity and activate the muscles in the concavity than the C's approach. And we use the C's approach for our younger kids that are maybe not able to do as much synthesizing that information and using it. But the Schroth method is fantastic for that. Opening up the concavity, activating the muscles that are atrophied, trying to get more muscle fibers in there, and trying to get more muscle activity out of those concave muscles. That has to be done along with elongating the spine and along with expanding into that concavity. And so I think it's really important that if you're being treated for scoliosis, whether you're an adolescent or an adult, that you're being treated with a technique that addresses this. We're not even talking about the 3 dimensions of scoliosis at this point. We're just talking about the muscle characteristics on each side. And keep in mind, the study was done with adolescent idiopathic scoliosis. So this wasn't adult scoliosis. And we still have that atrophy. We still have that fatty infiltration of the muscle, which kind of surprises me, actually, that these younger kids that are growing have such weakness in the concavity that they have fatty infiltration and atrophy. A lot of times we think of kids as very resilient and the muscles are good and all that, but we have an imbalance just like anything else. So now imagine what's happening in our adult patients that don't have the younger tissue and have had a longer time for fatty infiltration to get in there and to make those muscles even weaker and to reduce the type 1 fibers even more. Something has to be done. and it has to be done in a way that is consistent with what is happening with the scoliosis. So a pretty interesting study. I actually really liked going through that, but I think the takeaway is that we need to address those things that are happening. Whether that's what caused the scoliosis or not is less the issue. We need to address the imbalances that are happening. So thanks for watching, and thanks for listening to me ramble about research. Hopefully it was helpful. And if you are looking for treatment for scoliosis, definitely consider the Schroth Method. If you're somewhere where you can come to Align Therapy in Utah, we'd love to see you. And if nothing else, subscribe to the channel so you can see other research that we talk about. So thanks for watching, and we'll catch you next time.